Mayor Sean Patterson-Howard, Westchester County Executive George Latimer, Reverend Troy DeCohen, and Judith Watson, CEO of Mount Vernon Neighborhood Health Center, and the 57th Governor of the great state of New York, Kathy Hochul.
Good afternoon. Good afternoon. It is so good to see so many people in one room. We've come through a very difficult time, and I am so excited to see so many of you. So welcome to the Mount Vernon Neighborhood Health Center. Governor Hochul, welcome. We are so pleased and so humbled that you chose the Mount Vernon Neighborhood Health Center to talk about and to promote the Pfizer vaccine for our 5 to 11-year-olds. Joining me in welcoming you and everyone else here today is our board of directors, and I'm going to ask that you either stand or wave when I call your name. Our board chairwoman, Mrs. Barbara Anderson. Vice chairman of the board, Dr. Nick Cicchetti. And Karen Ford, daughter of the late David Ford. Before I get started, and Governor, I promise you I will be brief. Before I get started, I'd like to acknowledge the following individuals. Senator Jamal Bailey. Senator Shelley Mayer. Senator Pete Hackerman. Assembly Member Stephen Otis. Westchester County Executive George Latimer. Give it up for him. The budget was presented this morning, and we're hoping you were generous to the Mount Vernon Neighborhood Health Center. Mount Vernon Mayor Sean Patterson-Howard. County Legislator David Tubiello. David, don't hold that against me. Reverend Troy DeCohen. Superintendent Kenneth Hamilton. Dr. Shalita Amler, Commissioner of Health, Westchester County. Susan Fox, President and CEO, White Plains Hospital. Joshua Ratner, Westchester Medical Center, Executive Vice President. My sister, Ann Kaufman Nolan, CEO, Sun River Health. Maria Trusso, CEO, Form A Medical Center. And last but not least, Assemblyman Gary Pretlow. Also in the House, the Honorable Senator Ruth Hassel Thompson. Now I can go on, but I'm going to stop there because we want to get to the governor, and we'd also like to get to these wonderful children who are here today to get their vaccines. These are our heroes here today. Let's give them a round of applause. Okay, so are you ready? The Mount Vernon Neighborhood Health Center has been in existence for close to 50 years. We are the safety net provider here in the county of Westchester, providing health care, quality, comprehensive health care to the most vulnerable among us, okay? That's what we do. We're a federally qualified community health center, of which there are over 300 sites here in New York, where we serve 2.3 million people. Rose Duhan, the CEO of our New York State Association of Community Health Centers, is here today. Rose, thank you for all that you do. And at the federally qualified community health center, no one is, and there's a test, by the way, at the end of this, so please pay attention. No one is turned away, regardless of immigration status or regardless of ability to pay. Everyone gets health care at the Mount Vernon Neighborhood Health Center, and we operate 8 sites throughout this wonderful county, here in Mount Vernon, over in Yonkers, at our Greenburgh Health Center site in Greenburgh and also in the city of White Plains. We have school-based health center sites, and we also have a few homeless sites. So 8 sites, one-stop shop for the most vulnerable folks in this county. That's what we do. Governor, I know I said I was going to be brief. Our services are medical, dental, behavioral, specialty, and support services. We are responsible for the lives of 20,000 individuals with about 130,000 annual patient visits and our 300 amazing employees. Governor, just bear with me for a little bit longer. COVID facts. At no time in our existence was it more important, the services that we provide, than it was during the pandemic. When everything closed and our hospitals, understandably so, had to turn people away. And you know where they came? Mount Vernon Neighborhood Health Center. We remain open and accessible throughout the pandemic. We also recognize, Governor, that collaboration, partnership, testing, and vaccination is the only way out of this, okay? And we are tired, and we want to get out of this, right? And so in 2020, Mount Vernon Neighborhood Health Center erected one of the first COVID testing facilities in the state of New York, because a lot of the patients who we care for do not drive. So they couldn't drive to New Rochelle. They had to walk up at our testing facility. And let me tell you this, the testing facility stands today. If you park out back, there's a testing facility out there. It's a walk-up testing facility. And so we are grateful to you, Governor, and to the governor's office, and to the mayor here in Mount Vernon for helping us to erect this walk-up facility. To date, we've tested over 32,000 individuals. We work with the governor's office, New York State Department of Health, and Josh. Whenever I hear your name, I just get emotional, because we could not have made it through you and the Westchester Medical Center hub. You all kept it together, you kept us informed, and mostly you provided us the emotional support that we needed to get through the darkest time of our generation, right? COVID vaccines. The city of Mount Vernon has one of the lowest COVID rates in the state. 62 to 63%. 62 to 63%, while others are boasting percentages as high as 80 and above. The city of Mount Vernon has a COVID vaccine rate, again, 62 to 63%. We have partnered with the New York State Association, thank you, Rose, for the funding. Grace Baptist Church, Reverend Franklin Richardson, Reverend Simmons is here representing him today, to offer vaccine incentives. So we are paying for folks to get the vaccine. We are paying folks to get the vaccine. And to the lovely children who are here today, you will leave here with a $50 gift card for your vaccine today. And when you come back for your second dose, you'll get another $50. And it's thanks to these folks. In partnership with Mayor Sean Patterson-Howard, we'll be providing testing and vaccines, not only here at the health center, but throughout the city of Mount Vernon with the community development block grant funds that you've provided to us. So I say thank you, and Governor, I promise you this is it. Today it's about the kids, and so I am gonna end it there. Louis Lanza, I wanted to thank you. I said we have sites in 8 locations. Louis Lanza is helping us to develop one name, an umbrella name for Mount Vernon Neighborhood Health Center. So Louis, thank you for that. We'll be partnering with agencies such as nonprofit Westchester. Jan Fisher, CEO, is in the house. And so I am gonna leave it there because I think I've gone on for way too long. But, and my staff knows this, I tend to do that. But Governor, from the bottom of our heart, thank you so much for coming here today. Thank you so much for choosing us. Thank you so much for giving Mount Vernon Neighborhood Health Center a seat at the table. Thank you, Governor.
Judith, you don't thank me. We thank you. We thank you for the passion that you bring to this endeavor to make sure that people in this community are safe and that they're healthy and that they'll have a far better outcome than they would have had if it wasn't for you and all the angels who are part of the Mount Vernon Center here. And I want to thank all of them, your board of directors, the volunteers, the staff. It is extraordinary. You can go on forever because I'm listening to you saying this is truly what matters in the lives of the people we all represent, and you are making a profound difference. So to Judith and to all the entire team here at Mount Vernon Neighborhood Center, I want to thank you. Thank you. Let's give you a round of applause. It's always great to see our county executive here. He's been a little busy lately. Got through a couple of milestones, and he just looks a little more relaxed than I saw him last time, so that's a good thing. I hope they look that relaxed at some point as well, so I'm a little bit envious, and thank you for getting the budget on time. We're always happy to hear that as well. So also, you mentioned the pandemic, Judith. This individual works so hard to protect the people of this county. I went to the mass vac sites. It was one of the most exceptional in the entire state, and I saw them all. The experience, it felt like an uplifting, patriotic experience. There's all these beautiful images going through the arena and music and people just walking around with such an upbeat attitude about the mission before them. And I want to thank the county executive, George Latimer, for making that happen, county executive. Also, I come out of local government, so I'm going to show the love to the local mayor here. And we've worked very closely together. And you always are letting me know the needs of your constituents, how important they are. So I want to thank you and look forward to continuing working together for many years to come. Our Mayor, Sean Patterson-Howard. Let's give her a round of applause. And also, I was just, until recently, the president of the Senate. So my senators are my family, too. I can never overlook them, and I know how hard they work. And when you don't see them in the district, you need to know they're out there knocking heads with everybody else, because anybody that stands in the way of what their district needs, they better watch out. So I want to thank, first of all, someone who served before, and I want to show respect to her because she has always been such a great friend to me, Ruth Hazel-Thompson. You know, your service was extraordinary, extraordinary. You've been a tremendous partner of ours. And some of the more recent additions who I've had the pleasure of working with, Senator Jamal Bailey. Thank you. We've had many conversations about the needs of your district, and we are going to take care of them. That is my commitment to you. Create jobs, deal with these health disparities that came to light so profoundly during this pandemic. I want to thank you for all you do, and we'll continue to do. Senator Shelley Mayer, again, just knocking it out of the park up in our state legislature. Really a true fighter, really a true fighter. I thank you. Senator Pete Harcum as well, tireless advocate for the people you represent. Thank you, Senator. Assemblymember Gary Pretlow is here. Thank you, Assemblymember. Assemblymember Steve Otis is here. And if I miss anybody, also Reverend Cohen. We've prayed together. You've preached, I've preached. You're a lot better at it than I am, but that's all right. And I also want to thank you for all the service to the community. And I'm going to make an announcement if it hasn't been already heard here today. You're going to give her up to me now? Okay. Viviana DeCohen is now the new head of New York State Veterans Services, statewide. You can tell I'd like to surround myself with strong women. She is one tough cookie. Yes, she is. And it's got to be a tough man who can handle that. So all my respect to you, Reverend. And she's dynamite. I met her in person when I saw what she was doing out of Concordia and all the work she's done. I said, this is a person I need at my side to show the rest of the state how we're going to be fighting for our veterans. You put someone who's a fighter by nature in charge of this program, and we're going to fight hard to make sure that every veteran, whether they're recently returning or came back during an earlier war, Korea, Vietnam, where they did not get the recognition they deserve, particularly this week. We honor them not just now, but going forward. So I want to thank everyone in the DeCohen family. You'll be seeing a lot less of her. Sorry, got to learn how to cook, my friend, or Blue Apron or something. So we're here about the kids, and I know the little kids have a short attention span. That's okay, but this is a very, very, very special day as we put a spotlight on how important it is to get our children vaccinated. And the number one question I seem to get these days from the press and parents, like, when can we stop having the kids wear masks in schools? I want them to stop wearing masks in schools. The key to doing that is getting them vaccinated. And now we waited a long time. Finally, all school-age children are eligible for the vaccine. There's no excuse. We've ordered an awful lot. We have over 700,000 doses, 300,000 for New York City, over 400,000 for the state of New York. Half of the population of children in this age group, we already have the doses ready to administer, and we're ready to get more as soon as we need them. And that's what we're focused on, making sure that we have enough, that we continue to work with our local healthcare providers, like right here at Mount Vernon. Make sure you got a supply. If you run out, you call me personally, and make sure all these kiddos have their vaccination. Our pediatricians' offices, our clinics, drugstores, we will make sure they have whatever they need. Because right now, here's what I see, friends. A lot of demand. If you like the lines, it might be a little long, and all this is good. At some point, if the parents are any indicator, it's going to level off. And then we'll be starting to say, okay, where are the pockets where we need more kids vaccinated so we can let them feel normal again, and get out there and play and go to school without the masks on. That will happen when we get them vaccinated, but we also know that there's some areas that aren't doing as well, and Judith pointed to this. This area has about a 61% vaccination rate. This zip code right here, I always check on that. Statewide, I'm very proud to announce, and I want to get this right because I know I saw this and I thought this was phenomenal. As of today, 75% of all New Yorkers have received at least one dose. One dose. That's over 28 million doses administered. So I'm focusing on where it's not as high. I'm very competitive. I don't want any area to not be excelling in the way that they should, so we're going to make sure that that happens. So what we did was we surveyed all the schools. We asked them to partner with us. At least half of all the school districts are going to be doing in-school vaccination opportunities, however they want to do it, whether it's weekends, during school, after school, we're going to let them do that. We're also, 65% of school districts will be hosting them. That's even better than I thought. And I want to thank all the schools for their partnership. And I'm trying to help find some incentives. So parents, listen up. Listen up. Now, the $50 is wonderful. $100 is awesome. Keep doing that. But we have a plan I'm announcing today. It's called Vaccinate, Educate, Graduate. And what that means is, anybody have kids in this age group, you're not going to want to miss your chance. We are going to be allowing people to get vaccinated and then to be part of a pool, and we'll be selecting 50 names of children who will receive a full ride to a SUNY or CUNY institution. Tuition, fees, room and board, the whole 9 yards. So if one of your children win this, should probably take them to Disney World, because that'd be a very good thing. You'll have extra money now. You don't have to be saving for college. So everybody with children needs to do this. We'll be announcing 50 winners over 5 weeks. It takes place November 22nd until December 20th. November 22nd, December 20th. Enter at governor.ny.gov/NYS vaccine incentive, or there's a phone number to call. So if you don't have the ability to register online, there is a phone number to call. We'll make sure all that information gets out there. So I'm very excited about that. I think that's going to be an incentive. If anybody's sitting on the fence, this is the best. Well, there's two great gifts you can give your children. One is the gift of good health, and that's what they'll get when you get them vaccinated. And secondly, the shot at getting this full ride scholarship, which I'm very excited about. Also, we're announcing even more resources. We talked about the fact that there's a lot of disinformation going around there, which is a polite way of saying there's a lot of lies floating around. And unfortunately, people are believing the lies. We have to stop that right now, and we're working on it from so many different approaches. So we have a vaccination kit for parents, Vax for Kids campaign. We're gonna have social media messages, posters, information cards, kid-friendly stickers, translating all the documents into different languages so everybody understands how important this is. Again, this will unlock the door to a normal existence for all of us, and it starts with the kids. And also, these kids can't wait to see their grandma and grandpa. Probably Thanksgiving. A lot of families are getting back together. Maybe they didn't see each other last year because it was still in the throes of the pandemic. It's hard to believe, but we didn't even have a vaccine for adults available this time last year. Now the families will be gathering. Let's make sure that grandma and grandpa who suffered so much being away from the kids do not get sick from children who are exposed to other kids, because if everybody gets vaccinated, we're going to protect all of our family members. That's really, really important to me. So we're also announcing that we're going to be focused on getting more programs into our schools, as I mentioned. And one more thing, I like competition. Let's have a design contest. I'm going to pass out some stickers to the kids. I'll admit, with all due respect to whoever designed them, they could be a little more creative. Is that diplomatic level? I want to see what the kids want to see. I want to see what would excite the kids. So we're going to have a competition and let the kids design the stickers that we're going to give out all over the state. And as I was coming over here, I said, and I don't want adults to pick them, as much as I'd have fun picking it myself. I want kids to pick it. I want them to be the ones who decide that this is what they want to see. So we're going to get more information out about vaccinations. We're going to have the social media design contest as well as our sticker contest. And my friends, I am very excited about this. I'm looking forward to continuing to work with all of you and to make sure that we get it right this time. There is no reason, with all the resources available to us, places like this all over the state, there's no excuse not to get the adults vaccinated, get the kids vaccinated, and say we put this pandemic in the rearview mirror. We'll talk about it in the past tense and not the current tense. We're heading into the holiday season. This is when we have to be focused on our families. This is the best thing we can do for our families right now, is to make sure that they're vaccinated. So thank you for your time. Again, Judith, thank you for the heart you bring to this. It's so contagious to see your energy and excitement for what you do. And to all of you, my partners in government and others, I thank you for all you do for us. Let's get the job done. Thank you.
Please welcome to the stage Reverend Troy DeCohen.
To our governor, we thank you for visiting our community and bringing your strength and support to a community that needs you. You know, one of the things, and I just want to share this as a personal side note, Governor Kathy Hochul, my family, my wife and I, we have had the privilege to be with you over the years as Lieutenant Governor and have built relationship with you. And you're someone we have respected, someone that we support, someone that we believe in. So we thank you. My wife thanks you for the opportunity for her to now be missing from home. Or at least I know where she at, right? So that's a good thing. So we thank you, and our community truly thanks you. And of course, to our mayor, our county exec, our legislators, our senators, so many of you, God bless you. I didn't know I was going to speak, so I'm really unprepared. But as I sit and gathered my thoughts, One of the things, and it's a biblical presence, throughout, whether you're Jewish, Muslim, Christian, there is one theme that runs through the Bible, and that is to love God with all thy heart, soul, mind, and strength. And it said, and the second is like this, to love thy neighbor as thyself. And when we think about the vaccine and the vaccination process, it's about loving thy neighbor. We are getting vaccinated, not so much because of ourselves, that I want to protect my health. Yes, that's a good thing. But I also want to protect those that are around me. When I got my vaccine, when my wife got her vaccine, we're pastors in the church, we did it not so much for ourselves. We did it because I got people that come up to me. I got seniors and children, and I don't want to be the one that affects them with COVID-19. And it's a shame that we're talking about something that happened 2 years ago. We're still saying COVID-19. We're in 21, ready to enter into 22, and still talking about something that occurred almost 2 years ago. This is about us. And one of the things that I am getting a little disturbed about, we have now moved into an era where now it's about I and no longer we. I grew up in a community when it was about we. You would have a mother in the community. She would make a pot of food and she would feed all her children, and if it was left over, she'd feed her community. We have forgotten this is about us. This is not about I. And as I think about the whole vaccination program, the purpose of it is to save all of us. One of the saddest commentaries that I could present to you, and I'll close after this, is when the pandemic first hit, and as a county exec, he knows, when the pandemic first hit, one of the worst things that had occurred is that people that were infected and that were dying were in the hospitals in the room by themselves. They couldn't have their family members, their children, their loved ones. No one could come in that room even to hold their hand while they were dying. Their families couldn't even say goodbye to the individual. And that broke my heart when I witnessed people dying, funerals that I had to do because of this deadly disease. But here's our truth. We, and say we with me, we in the church now. We can end this together by everybody being vaccinated. We can end the pandemic, and we can end people dying alone. My 16-year-old daughter, she had both of vaccination shots, 16. And she has had them, and she's well. And I'm asking all of us together, vaccinate your children. We do it for school anyway, with measles, mumps, and rubella. We vaccine anyway. We are a vaccinated nation. So why not this? And let's end the myths, end the rumors, and let's start saving lives. So I thank you, Governor, always from the bottom of my heart. You're special to me, and all of you as well. But we can do this together. Thank you so much.
Please welcome to the stage Mayor Sean Patterson-Howard.
Good afternoon, everyone. Thank you for coming. I want to start off by saying thank you to my partner in eliminating health disparities here in the city of Mount Vernon, Ms. Judith Watson of the Neighborhood Health Center, to our partners in state government, our Governor Kathy Hochul, our Senate and our Assembly members, our county legislators, our county executive, and our community partners. I have had the very unique privilege of working through two of our generation's greatest and most devastating pandemics. I've worked in the area of HIV/AIDS since 1985, sat over in that corner very many days with Miss Shirley Gibbs Bryant, and we served people here. The health center was here. When COVID came a reality in our community, again, the health center was here in one of the poorest census tracts in the state of New York, in what people call a dangerous neighborhood. You have chosen to come in and ensure that top-level services are provided to our community's most vulnerable populations, and we thank you. We thank you. The Neighborhood Health Center has gone from a trailer that was almost the size of your testing site in the back to the facility that we stand in right now. And when COVID hit and we were operating in uncharted waters and people were afraid, we came together and we fought with our Senator Bailey and our Senator Biaggi and our Assemblyman Pretlow, who called their Senate and Assembly partners and advocated to make sure that we had a testing site here in the city of Mount Vernon. So thank you. And here again, when we needed vaccines, and we needed them desperately, because so many were fatigued by COVID and being isolated and not being able to see their families and enjoy social activities, and had become in despair. Again, the health center, the state, and the county, and the faith-based community became our partners in delivering vaccinations to our seniors, to our adults. And then when the teenagers got them, again, the health center stood on the front lines in partnership with our partners in government. And now, as we serve our youngest, so we could see the smiles of our children again. I don't know how many of you miss the smiles of children running. We see them running and we hear them laughing, but we don't get an opportunity to see their faces. Why? Because they're masked. They're masked because they're not vaxxed. And as we move forward and we're able to vaccinate our children, their grandparents will be able to see their smiles. Their friends will be able to see their smiles. We'll be able to see their smiles. We want to move back to normalcy, whatever normalcy looks like. But the only way that we can do that is through vaccinations. I am the child of a young woman who at age 4 became the first polio case in the county of Westchester, my mother. And so I understand the importance of epidemics and viruses, and I understand the important role that vaccinations play in eliminating these major challenges to our community, to our socioeconomics, and to our health. And so thank you everyone for coming together today, because we have to eliminate it. And as you said, Reverend Cohen, HIV and COVID and every other disease look very much the same at the end, but especially COVID and HIV, because people were sitting in rooms dying by themselves without their families. And we cannot continue that practice. We want people to be able to live and die with dignity and family. And the only way that we will do this is if we ensure that we're increasing our vaccination numbers. I'm a Howard University graduate. I believe in black girl magic, and I've heard every conspiracy theory that's come across the page. But what I also know is I have doctors and I have nurses who are black and brown men and women who have participated in studies and in treatments, and we know that we are doing this through informed choice. This is not a Tuskegee study. This is saving our lives. And so we have to push aside the disinformation and misinformation. Yes, that is a part of our history, but we have to start a new page and a new chapter in the history of our community. We cannot feel like we are being avoided and being kicked out and we're not being given health services. We are begging to be saved. And the only way that we can do that right now is through vaccinations. We can't continue to isolate for the rest of our life. So thank you again. Thank you, Governor. Thank you, Mount Vernon Neighborhood Health Center. To our state leaders, our county leaders, we appreciate your partnership, and we look forward to getting shots in arms so we could see the bright smiles and hear the incredible laughter and hug our babies who we love once again. We don't want to have a generation of children who grow up not knowing what it feels like to be embraced by their family without barriers. Let's get this done. Let's get it done now. I am proud, and it might not be proper in English, but to say I am melanated and vaccinated. Hashtag that, and let's get it popping.
Please welcome our last speaker, Westchester County Executive George Latimer.
The author, Thomas Wolfe, said you can't go home again, but 6.5 blocks from here was the neighborhood in which I grew up. And if I go back 57 years, I was one of these young kids, 10-year-old kid in this very neighborhood. And Governor, by being here today and by the allocation of these 500 units of pediatric vaccine and the 600 units of pediatric vaccine that we have in Westchester County that we'll be administering tomorrow and the following day in White Plains at our clinic, you're making a statement that these kids matter. These kids count. And when I look at these children, I see myself in a different age. There was no neighborhood health center here 57 years ago. Judith said 50 years ago it came to pass. But it is so needed because the people in this neighborhood are not people that you can forget. They're not disposable people. You may remember years ago there was a story about a baby who fell in a well in Texas, baby Jessica. And all night long there was a group of people around the well and they figured out how were they going to get this baby out. There was methane gas. It was not simple. And there was great joy when that one child was pulled up out. Baby Jessica today is a woman with 2 children of her own. And that's what happens when you invest in young people. There's a life beyond that. So, Governor, what's happening today in the city of my friend the mayor, with all of my friends in the legislature that have fought for this city over the period of time that we've all been in public office together, we're making a statement that the young children of this neighborhood are not disposable. They are part of this American mosaic. They're part of the future that they will grow up to be as we have become as adults. They will be productive members of this society. They will achieve things that we can only dream about if only right now we can address this pandemic in their lives. That's what these vaccines mean today. And the people who are out there who never made it down to 4th Street, who never made it down to Leicester Towers, don't know where Mundy Lane is. Remember that this is also the neighborhood that produced Denzel Washington, the great actor, contemporary of mine. Much better looking, much better basketball player, got all the girls he wanted. This neighborhood, like all the other neighborhoods, and the governor, you have many more neighborhoods than we have in the county. All of those neighborhoods in Brooklyn, in Buffalo, in Syracuse, in Albany, those neighborhoods matter. And that's why public money is being used to make sure that we protect these individuals. We're all here today to say thank you to the state of New York, the governor and the legislators that made this possible. We're all here to stand by Judith and her team at the Neighborhood Health Center, and there is money coming from the county. I got to get David to vote for it. David, where are you over there? But we're here because we owe a debt to the future as the past paid a debt to us. So let us together leave here committed to doing everything we can to protect this generation of Americans because we owe it to them and we owe it to this city and to this country. May I say thank you on behalf of a grateful county and city, Madam Governor, Madam Mayor. Thank you all. Have a very good day.